Obesity is projected to double by 2030, and in 2024, 3.7 million deaths were linked to it worldwide. To address this growing problem, the World Health Organization is issuing global guidelines on the use of GLP-1 medications for treating obesity. It's the first time they've done this. Certified nurse practitioner at St. Joe's Weight Loss Center is joining me now to go over the guidelines. So, Christy, to start, how do the GLP-1 drugs even work?
So GLP-1 drugs work by decreasing gastric emptying, which means when you start to eat, you feel full faster and you stay full longer. And so therefore appetite decreases and you don't eat as much because you're feeling more full. And
what are some of the best ways to have a comprehensive approach at using it? Because there are side effects. What do you always recommend patients do while they're taking this medication?
With GLP-1s, when you first start the medications, side effects can occur. They normally include nausea, diarrhea, constipation, more gastrointestinal symptoms. So we always start at a low dose and then we increase it as time goes on. So it's very important to include education with the patients. It's also important to teach them about the importance of exercise and physical activity. With this medication, when you lose weight, you lose lean weight as well as fat weight. So it's super important to keep your strength up and exercise. Dietary interventions too, to make sure that you're getting the proper nutrition along with your decreased appetite.
Because if you don't do that, what kind of effects could you see? Because I even hear about it at the hair salon. You better get your protein because it'll affect your hair.
Oh, sure. So hair loss is a big one potentially for some patients if they don't keep up with their protein intake. And again, just overall weakness, and patients lose strength. And so it's super important that they incorporate the physical activity and dietary changes with it as well.
And this is the first time the WHO has weighed in on using these drugs. Under new healthcare proposals, there are exceptions that, you know, the cost of GLP-1s will be covered. Sometimes they may be lower. Have you heard anything about maybe in the proposals to lower it or make it more accessible? What are you hearing in your field?
So for sure, in the beginning of 2026, there is a proposal to come out where these medications are going to significantly decrease in price for patients that are self-pay. Some insurance companies cover them with low copays. Some patients are self-pay. If you are self-pay now, they started at over $1,000 a month per injection or per month per patient. They are projected to go down to about $350 a month at the beginning of 2026.
Okay, and that was what the White House was announcing.
Yes.
Do you think there may be more, improvements in terms of cost or more accessibility in the future, knowing that this is so popular?
I hope so. I believe so. I think that there are more pushes towards the pharmaceutical companies to produce more, to be able to get the price to come down, just due to the increase in demand in it as well.
Now, there are a few studies out, and they show GLP-1 drugs may have benefits aside from weight loss. Zepbound is linked to helping with sleep apnea. Wegovy linked to reducing risk for cardiovascular events, heart issues. So how much evidence are you seeing of that? Do you think that this is helping quality of life as well?
Oh, for sure. So just in general, obesity can have other negative side effects on patients as far as heart disease, diabetes, high blood pressure, sleep apnea. So with the medications and the weight loss, those cardiovascular risk factors significantly decrease. So overall quality of life, as well as the patient just being healthier, and decreased risk factors for those things significantly occurs.
And really quick, who would be a good candidate to at least explore using a GLP-1?
So any patient with a BMI, body mass index, greater than 30, that is what is the diagnosis, so the benchmark of obesity. So over that would be something to discuss, start to talk to your primary care provider about and see where you can go with it as far as getting access.
All right, thank you so much for all of the information. I think everyone's real curious what the future will be in terms of managing weight loss and obesity. So thank you so much for being here to give us an update.